or the different things that would be necessary for us to do. I think it goes to, we need to know who we can get the good information from. If that's the health department, if that is whoever is leading the way with showing us the rise or in the the more stuff going on. Um,
Excellent.
Thank
So,
you.
Mr. White, could you tell us what branch you're associated with?
the Marion County branch.
Marion County. So I love your example, and there's a few key things that I want to call out. I think one, you talked about, right, that looking at some of the priorities, and the big priority for your branch is the census. And I appreciate you putting that back in the context of, when we think about one of our primary priorities with the census, putting it in a scenario, right? Who are some of the partners that we can be working with to make sure we're getting the right kind of data and information? That and having that executive committee meeting or that call to action, so to speak, to make sure that the entire branch or the leadership team is kind of seeing the same information. So thank you very much for that perspective, Mr. White. I think that's a very helpful way to think about it. Um, and I think, Kanaya, we have a few more comments in the chat. And I think, so we see from Miss Melvin, she's talking about, she just gave food this Friday to a community. We have President Haley from Illinois that talks about her role as kind of former regional chair for the Red Cross. Um, and then I actually want to jump to, for the next person that we'd unmute, Sean Kinsey kind of speaks and is picking up a little bit on what Mr. White said in terms of utilizing local government for volunteers, law enforcement, higher local officials, and other civic groups. So if we can, let me find Sean so we can unmute Sean. And Sean would love to kind of think about, again, from the branch perspective, there's multiple Sean Kinseys. I don't know which one I'm going to pick, so I'm just going to unmute one. um, but Mr. Kinsey or Mrs. Kinsey, don't want to assume. But what are some of the other things that you're thinking about as it relates to just where the role that the branch can lead out on and where the branch can assist with some of the activities based on the scenario? I see there's one of them unmuted. Or one of them is allowed to speak, rather.
I can go and see if I can unmute the other Seans that we have logged in and see which one works. Let's see.
All right, so we have 3 Sean Kinseys. Do one of you all want to chime in? All right, we got one.
Okay, I just unmuted.
Awesome.
I just unmuted. Yeah, one of the things that I think, especially in light of what's going on, would be to utilize some of our local government officials, civic groups, and law enforcement. I think certainly for law enforcement, it would be a bonus to be out there helping and providing a respite to deliver some of these meals to our seniors or needy families.
Mm-hmm. No, I think that you're right about that, Mr. Kinsey. And then could you tell me what jurisdiction you're with or what branch you're located with?
Manatee County.
Okay, Manatee County. No, thank you for that. And I think you're right. So I think what you're speaking to is also important in terms of just thinking about the different type of first responder groups that are going to be providing essential services and having an understanding of what each first responder's role either can be or should be as it relates to providing some of these emergency services. And so law enforcement, and particularly in a state like Florida, when we think about law enforcement, there can be the conversation about the police, but then also the conversation about the sheriff's department. And each one of those levels of law enforcement may have a very different level of engagement that they are working through. And so I think one of the key things that we want to think about, right, in terms of who we can count on or where you can lead on, is going back to those other networks that you work with maybe on a day-to-day basis. So you may already have a relationship with the sheriff's office, and they may take the lead role in an emergency management context, and just getting a sense of what they can, getting updates from them where you can on how they're coordinating across the other government levels of government. I want to take a transition for people that are on either at the state level, the state conference level. If there's anybody that represents some of the state conference interests, what are some of the big questions that you are leading out on, or how can state branches, or from the branch perspective, right? What are some of the things that you would be looking for from the different branches at this time in terms of just thinking about activating in terms of a disaster and collaborating with some of the government and non-government partners? Is there anybody from the state? And if you have any comments or questions from the state level, if you can just drop some information in the chat, and then we will pull up one of the state conference folks to provide some perspective.
Right,
Good evening. This is Tori. Can you hear me?
Yes, sir.
Yes.
Yeah. So good evening again, everyone. So I'll just make some quick comments. So our state president, who was on earlier, rolled out branch emergency management plans. So many of our units across the state of Florida create these plans in conjunction with the members. They worked with and listed their various community partners and organizations during disasters, clearly primarily hurricanes and other disasters, resources for those in their communities. So I would actually ask many of our branch presidents and unit leaders who are on to maybe talk through their branch emergency management plans, because many of these were created several months ago.
Mr. Austin, that is great. It's good to know that branches have been encouraged to develop some emergency management plans. And I think that that is a good first step, as well as if they have been drafted, revisiting them and seeing where it can be helpful in helping to guide some of those early decisions, again, in the context of reactivation for many instances. And so very
And
much.
I'll just quickly add, and I've been purposely quiet all evening, between the leadership of our, state president and Jackie at the national level. I mean, we have really tried to, lead the way in Florida. And again, I won't steal the thunder of our unit leaders, who I see many are on. So I'd ask some of our units or branches to, feel free to chime in and talk through, just their branch specific plans. And kind of what that entails, locally.
No, absolutely. No, thank you very much for that. So I think what we're going to do now, we're about 15 minutes for the first part of the scenario. So we're actually going to move it along. Kanai, if you can move along to the hurricane portion. So again, usually when we do these exercises, they can happen in a half day or a full day context. But we're going to transition now and just make a quick jump to the hurricane part of the scenario. So again, we're still in a pandemic as we get to this part. So Kanai, I'm going to pass it along to you, and then we'll go back to questions. We'll do it in the same way. We'll have the branches, if you want to chime in from the branch perspective first, and then we'll roll up to the state conference. And then what we'll also do, I know we have some external guests within the family from other state conferences. If they want to add some perspective, we can add that as well. And then we'll move on to the next scenario. So Kanai, over to you to give a description.
Thank you. So here we have another scenario. Let me make sure I have my screen. So we're looking at a tropical storm passing over the Caribbean islands. And this is out in the Gulf of Mexico, passing over Caribbean islands. And it gained strength over the weekend. And we are anticipating severe impacts across states, including Florida, Alabama, Georgia, and possibly even Tennessee. And 2 days later, we see it makes landfall, directly impacting the Panhandle, bringing widespread flooding and extreme damage to communities in Florida. And we're also looking at communities in Southwest Alabama. Now, remnants of the storm, a few days later, we're seeing it pass up the eastern coast, the southeastern coast of the US. And we're seeing impacts in North Florida and passing up to Georgia and Alabama. And we're even seeing, not in the slides right here, but impacts in North Carolina and some of those Outer Banks, eastern island regions of North Carolina. And so bringing this back to discussion questions, and it's important to note here, this scenario is happening on top of COVID. So we still have the same considerations earlier with strains in the community, failed reopening plans, and many community members not able to practice social distancing, and many volunteers in charge of food distribution and support with medical deliveries. being impacted by COVID, and now we're seeing impacts from flooding. And so we're seeing, of course, there's going to be transportation impacts. We're going to see power outages widespread across the Florida Panhandle. And the storm is also moving up to Georgia and Alabama. But of course, we're here in Florida looking at those impacts. So the first question, of course, is just thinking about what role your branch has in responding to hurricanes and what that looks like in the context of COVID.
And so for the Florida State Conference, we know that you probably know how to do this better than any other state, barring some other Gulf states. And so I know hurricanes are not uncommon to many of the folks from the state conference. I think the context that we're talking about this is might be a little bit uncommon. I'm going to hold on Mr. Collins' comment because he actually asked a very important question in terms of who your neighbor is, if you all want to see that. But would love to kind of get, based on Kanaya's question, at the branch unit level, when you're responding to a hurricane, what are some of the first things that you're doing? What are some of the things that you're thinking about in terms of your role? So if you want to drop any perspectives or ideas in the chat, we'll call on folks from there.
I see we have a few raised hands. I don't know if that's lingering from previous discussion, but I see a Lewis Jennings. I'll allow you to talk if you're able to chime in, but if not, perfectly okay if that is timed out.
And so while Mr. Jennings is tied, coming off of mute, I think one of the other questions that we talk about when we think about roles is we also think about who are partners that have other roles that we should be working with. And so we've already heard some names earlier this evening, but who are some of the other organizations that your local branch or unit would be reaching out to as part of the hurricane response, just to make sure that all of the needs are met? So Lester Jones, you asked a good question. I actually wanted to have you speak to it a bit more. So Lester's question was, I know you said not to fight the scenario, but in such cases, will we not be receiving meeting directions from first responders?
Lester, yeah, I would love if you're able to hop offline and speak to your, not offline, hop off mute and speak to your question a little bit more when you say meeting directions from first responders. Are you thinking about evacuation route here?
Yeah, so you can hear me okay?
Yep.
Yes.
So I guess what I'm saying is, because we're not isolated, so we would be taking directions as citizens of the county or city or state or whatever. We would be taking directions from the local government or the first responders or what have you. So our response would be pretty much in response to those directions, correct?
Correct. So, right. So that is an important consideration, thinking about, from what I'm understanding, yourself as a citizen and someone who's impacted by the disaster, and how you both respond to and adhere to evacuation routes and mandatory evacuations and curfews. But then how are you also meeting and convening with your fellow NAACP chapter partners and leaders to form an organization response? So really want to think about what that looks like and how you balance those priorities, because that is something we think about all the time in emergency management, is that oftentimes people are themselves impacted by the disaster. And so how do they manage those priorities?
And then Mr. Jones, are you still on the line?
Yes, I am. I'm kind of smiling because, you know, if we are told to evacuate because a hurricane is coming,
Mm-hmm.
I hope the branch members are also evacuated, because
Yeah, no, that, you know what? It's so, Mr. Jones, I think you nailed it, and that's one of the roles that the branches and units can play, is that if the branch and unit leadership is receiving notifications to take an evacuation order or shelter in place, I think one of the roles that you're unpacking is making sure that all of the membership of that branch or unit is heeding whatever that order is. And it's particularly important, I think, in kind of this new context, especially with what's happening with the pandemic. So I appreciate you raising that point. Mr. Jones, what branch or unit are you affiliated with?
Santa Rosa 5094.
Okay, Santa Rosa 5094. Excellent. Thank you very much with that. We also had, in terms of the partner question, we had Miss Diane Keys mention the Red Cross, which was also uplifted up by President Haley from Illinois. Ms. Keys, if we're going to find you so we can unmute you, if you want to talk a little bit more about why you would reach out, or what the relationship is when you reach out to the Red Cross in a context of a hurricane for folks at the branch level. So we just allowed you to talk, Ms. Keys, and then if you want to take yourself off mute, be happy to hear more from you.
Good evening.
Good evening.
So I am a part of the NAACP. I'm also a volunteer with the Red Cross. So I would reach out to them to see what their plans are.
That's a great point. And so I wonder a lot about basically the redundancies in organizations as they're supporting disaster responses. So you seem like you probably have a very critical role having connections with the Red Cross and also partnering with them and volunteering with them. So say for some reason, some unfortunate reason, you were unable to be the person, the point person or the lead person for that response to those activities. How is the rest of your organization and your partners, how are they looped into those efforts? And how are they able to pick up the slack if you're not able to be there?
Well, usually we have several numbers. So if you don't reach one person, you should reach the other person. So we have a group of us that have the numbers to contact each other. So we have like a phone tree.
That's a great example.
Yeah. No, appreciate you for sharing that, Ms. Keys. And I think I got your location. If you can give it one more time in terms of the branch and unit. I'm sorry about that.
I'm in Collier County, Naples, Florida. Branch 117.
117. Thank you very much, ma'am. Appreciate it. So we have a few more comments in the chat. And I actually want to go to Ms. Pamela Brown. So she picked up on something that was important. She was saying, just looking at the scenario, since South Florida was spared in this scenario through the Red Cross, we'll also learn where certain responders are needed and thinking about donations. And so if we can get to Ms. Brown, would love to talk more about just, again, if South Florida is spared from this scenario. Now remember, we are still in the context of a pandemic, but what are some of the things that you think would be helpful and useful for South Floridians or members of South Florida to help your family and friends to the north at the Panhandle?
I think we've unmuted you, Ms. Pamela.
Hi.
Hi.
Hello. Hi. Okay, so one of the things we discussed earlier with the Red Cross is that volunteers are needed, and we're trying to actively recruit members to become CERT responders, with the understanding that a CERT responder could be sent to outside of your neighborhood to help, and that would mean possibly traveling if you can. So.
And are there existing communications plans between, assuming you're coming from one of the South Florida chapters and thinking about having volunteers deployed to the Panhandle region to support, are there communications channels that exist to facilitate that coordination?
I don't think we have any, I don't think so, really. I know that we talked about housing is always going to be a problem because the residents of that area are going to need housing, but yet you have all these volunteers coming into that area that will need housing. And so we know that that's an issue. We've talked about is it possible to have our own RVs so that we drive our own RVs and can hook up in a location? But then we realize RVs are expensive, and then there's issues within, I guess, within counties on the restrictions of RVs being directly hooked up at a residence or within certain neighborhoods. So we were saying there's could be some policy issues, but we're thinking that if it's a natural disaster, a county government or city government would relax those policies because it's temporary, but haven't clarified that yet.
No, and so Ms. Brown, I appreciate, and could you let me know what jurisdiction you're in again?
Miami-Dade County.
Miami-Dade County. So I appreciate you speaking, I think, to a few key things I think are important at the branch level and unit level. And this is kind of what we're hoping to get to from the discussion. I'm glad that you called out that there's already been some pre-existing conversations with the Red Cross and with people who manage the Community Emergency Response Team program. And again, in part of the scenario and talking this piece through, right, is as Kanaya was raising that point of different modes of communication. I appreciate you also sharing, right, that there's some ideas that you thought about, but that's something that you continue to talk through. And I think that that's one of the things that we always want to emphasize through this process. And so no fault for not having an immediate answer. If anything, just appreciate you putting that out there and throwing out some of the ideas that you engage. And then want to come back to a point that you were making toward the tail end that Ms. Gloria King has raised in a few different contexts, that since this scenario is happening in the context of a pandemic, it looks and feels very different, right? In terms of the local government guidance that's coming, in terms of the state guidance that's coming, and honestly, like in terms of just your individual situation as a member of the NAACP, you want to make sure that you are staying as safe as possible while you're supporting others. And so if we can go to Ms. King, if you can just kind of give a little bit of your perspective of some things that you would be thinking about as a member of a branch or unit, again, that's looking to help support people the best way you can while staying safe. Would love to hear from you. So we will come and unmute your line, or you're already able to speak, and Ms. King, we'll pass over to you.
Hi, yes, can you hear me?
Yes, we
Yes,
can.
ma'am.
Yes, this is already problematic, and the government is saying there's going to be 2 years for a cure. We cannot wait 2 years for a cure for COVID-19, and this is problematic during hurricane season, tornadoes and flooding, and we're already struggling. Our senior citizens, they can't leave their houses. Everyone has fear and panic has set in. So we cannot wait 2 years for a cure and then being told to go to a hurricane shelter with the 6 feet separation in place. That's kind of scary. A lot of people are going to want to stay in their homes and take a chance of surviving, even if there's flooding, even if there's hurricane damage. They're going to feel it's safer to stay at home than contracting COVID-19.
Absolutely. So Ms. King, to that point, what are some questions, so just outside of the scenario, what are some questions that you would want to know from your local government today? And what are some questions that you think the branch should be asking some of your local government officials about that sheltering piece?
When is that we're going to find a cure? I mean, a definite cure for sure, and not take 2 years, not take a year, but to relax, because this 6 feet, this social distancing, how long do they really think we're supposed to live like this? How long can they expect for us to stay at home and we have full businesses and jobs? When is there going to be a definite cure for real, like sooner than later? And as far as, because we got to go to some of the people have to go to hurricane shelters, and the more we get together, it it spreads the disease. This is not good right now. This is dangerous for everybody.
It is a dangerous situation, Ms. King, and I think with the concerns that you're raising are a valid one, particularly as we are, I think as private sector and government are working at breakneck speed to find a vaccine. And I think the reality of it is, and kind of the purposes for the scenario is, unfortunately, it's not going to happen fast enough. And so I think some of the questions and things that you raise are very important as it relates to, again, if they do make a call for people to evacuate, if they do make a call for people to shelter in place or to go to a congregate shelter, what are the operation protocols to ensure that people are staying safe? And where's the personal protective equipment? And so I will drop a resource in the chat that is federal guidance, but that state and local governments are trying to figure out right now. So I appreciate you raising that concern. And I think it's always appropriate, right, to have that conversation with local government, with county government, with the state, and just thinking about what are the protocols that they are establishing for evacuations, for congregate sheltering, and just making sure that we can keep people as safe as they can, or for people that are unable to move because they have an autoimmune disease, right?
Correct.
That we're to take care of them as well. So I appreciate you for raising that. And we'll definitely, we'll keep that in mind. And that's a helpful point to raise for this scenario. So Kanaya, I want to pass it back to you to take us kind of to the next part of the. Oh, thank you very much. Oh, Ms. King, I'm sorry. Can I get your location in terms of where you were? I'm sorry about that.
Pasco County Branch 5630.
5630. Thank you very much, ma'am.
You too. Good night.
Thank you. And so I think, so Kanaya, if you want to move into the next part of the scenario. So there were some points made about neighbors, and I think to Ms. King's point, I think it's really going to speak to just thinking about some of the populations that the branches are serving. So the questions in full, we're going to send those slides so you can work through those together. Kanaya, if you can go to the next part of the scenario. We're going to go past recovery, and then let's just move straight into the partnerships piece. So when we talk about partnering for population support, so I've seen some information in the chat to think about people that have transportation needs. We've heard about people who may not have access to food. And we've also heard of some of the groups in the region that can support people. But in terms of some outstanding questions, I'll pass it over to you while I drop the resource in the chat that I mentioned to Ms. King. If you want to talk, Kanaya, about some of the population support aspects, and then walk them through the next set of questions.
Thank you, Marcus. So right here, we're talking through, with all the scenario injects we've thrown and the overlapping issues we're looking at, we also need to be mindful of how we're supporting specific populations and how we're thinking about these populations, how we're identifying the groups that need the most support, and how we're creating partnerships that can best tend to their needs. And so one of the questions we like to think about is, what are some of the groups in this region that need particular support during disasters? And I'm sure it may be obvious to many people on the call, but we really want to kind of talk through and brainstorm ideas on how we group people together as, either high risk or vulnerable populations, and how we're getting information to support them in protecting themselves during times of crisis, how the NAACP is uplifting information that's most helpful to these groups. I see a few comments in the chat.
So I think you're getting a little bit of context of what's happening in some communities. So they're saying in Miami-Dade County, they're going to wear masks in all shelters, and that the shelters will operate at reduced capacity. And that's going to be important for some of the populations that would need support going to those shelters. If you can go to the next slide maybe and see if there's some additional information. And so this is an example of some of the special populations that we talk about considering. And I know many of you are familiar with these folks and you support them already. And so when we think about the elderly and aging population, also the hearing and visually impaired, thinking about some of the homeless population, and then thinking about folks that for many reasons are homebound. Are there other special populations that aren't listed here that your branch, your unit is going to be looking to support, or that will be looking to you for support in times of either one of the scenarios that we laid out, either the hurricane or the pandemic? If you can drop some types of populations or some people that look to your branch in the chat, that'd be greatly appreciated.
Right. In addition to that, as you're thinking through other populations, offering up strategies that you have used in the past or are currently using to reach these different groups, because I think that's just as helpful to think through these existing groups that we've outlined here, some of the populations we think about a lot with a lot of different organizations, what your group has done to support these populations. see a comment from Carol Jackson about people without funds to prepare or evacuate. And that is an incredibly important consideration because we know oftentimes people aren't necessarily choosing to not follow evacuation orders, but they're not able to financially, they don't have the financial resources to have a backup evacuation and shelter plan. And so how do we share information? So Carol Jackson, I would love to take you off mute if you're able to offer some insights of strategies used or strategies you're thinking about to support people without the funds to evacuate. Let's see if I can.
Hi. So can you hear me?
Yes, I can.
I don't have any great ideas. I was hoping to hear from other people with great ideas.
Well, that's
All
okay.
right, so yes, no. So we'll turn it to the chat first for some other great ideas, and then we can chime in. Kanaya, we'll chime in on the back end.
Because
go ahead, Ms. Jack. Go ahead.
Just that I'm pretty sure that, I mean, a lot of those may not be our members, but they are our community.
Mm-hmm. No, absolutely. And so I think one of the things that we would look to in terms for people that don't have the means to evacuate, or maybe they aren't able to find somewhere to stay. I think one of the things that we do want to think about, right, and this is kind of the conversations we can have up front or before this kind of scenario, is talking to some of the county governments or some of the nonprofit partners. So we've heard about the Red Cross, and basically getting a sense of like where some of those referral services may be now to help provide some initial support.
Yeah.
So that would be one idea. Can I go ahead?
Yes, I wanted to also add on the United Way and the 211 line. Also a great referral, can oftentimes be a great referral service, pointing people to local services that may be able to support them in times of disaster. So really pointing people to those kind of sources and uplifting information that helps them to find sheltering situations or sheltering services.
Yeah. And Ms. Jackson, I appreciate what you're raising because it also speaks to where can we help branches make sure that they have a list of quick referrals, and some of the branches or members within your community may already know the referral services to leverage for other types of emergencies. And so that can be a good starting point to help support people that may not have funds to prepare to evacuate. So we have Kimberly Wright on the line, who has been on fire in the chat the whole night. I've actually very much appreciated her perspective. I want to pass it over to Ms. Wright to talk a little bit about some of the other populations where she talks about residents in substandard housing. And she has some information about some of the standards that or some of the support that they provide for mitigation efforts for substandard housing. So Ms. Wright, do we see if we can unmute you? There are 4 Kimberly Wrights, and I don't know which one asked that question. So if you did ask that question, if you can raise your hand, please, that'll at least help you identify if we have the right one.
I think we got Ms. Wright. Are you able to speak?
This is Alma Miller, actually under Kimberly Wright.
Okay.
We're in Indian River County 5151. And yes, I've been blowing up chat because I am on the executive board at 5151 for Health and Housing. And during a pandemic, as well as with hurricane and any other emergency, residents living in substandard housing has always been an issue. Seems like they're left behind because they're supposed to be able to handle their own business. But we've noticed, and we've had to deal with our residents in the vulnerable areas that are in substandard housing in need of help. And what we try to do is in the mitigation phase, we try to have them help them repair their houses and give them things that are needed. Prior to the pandemic, for instance, if a hurricane is coming and someone is living in a house where the roof leaks, we make sure they have tarp. Those are just something simple that we do.
Appreciate that very much, Mr. Miller. And I think that that's a great example of not just a potential population, but then also a solution. And so I think if you want to, please connect with 5151 Indian River Branch, and I think get a little bit more information about some of the mitigation efforts there. I want to go back to Pamela Brown, and then we will transition to closing out this part of this scenario discussion. So Ms. Brown, you actually raised another population that I think has a lot to offer, and may also have some special needs or some specific unique needs, which is veterans. And I'll expand that a little bit to say veterans and military families. And so, Ms. Brown, do you have, or if we can, let me see if I can find you again. And yep, Ms. Brown, are you on?
Yes.
So yeah, if you want to talk to us a little bit about the veteran population.
Well, we actually have a chairwoman who works with veterans, and so I don't know all of the things that she does, but I know that she's always telling us about how this is a very important group of men and women that are often they don't often get the services that they deserve to have. And I know that she is actively working with a church in our area that provides housing assistance, as well as I think some education programs for this group of people, but that's basically all I know right now.
Okay, no, that's helpful, and that's I think an important context, and a few things that you pointed out there that would work very well for the scenarios we're thinking about the populations to support. Is it's looking within the existing branch and the committee and the chair structure to identify the chairman and chairwoman that are working with these populations on a day-to-day basis to see what they're hearing, what resources need to be provided, and what other organizations they may be able to connect the branch with to help meet those needs. And so no, that very much a good point raised there, and thank you for sharing that.
Actually would love to, just being mindful of time, would love to jump to some overall scenario analysis questions to think about the challenges we're seeing and opportunities for growth. If that makes sense. And you guys will all have these slides, so there's a lot of questions here to help you think through these solutions. So I kind of want to take a second to get to what we call a hot wash. And so in an emergency management exercise, we take a time at the end of an exercise to think through the solutions talked about and the issues raised and identified, and really think about what we were able to respond to certain scenario pieces and the opportunities for growth in the future. But I also see there's some really awesome comments and a lot of activity in the chat, so I don't want to cut off any thought flows that are happening here.
Yeah, I think, Kanai, to your point in terms of a hot wash, the last question that we want to end it with, there's a few questions here, and as you mentioned, there's a full deck, and the full deck you guys can use as branches and units and state conferences to walk through this. But I actually want to close on strengths. What are the strengths that your branch or your unit or your state conference has that you think could be useful in some of the scenarios that we've discussed? And so if you want to drop those in the chat, we'll pick one or two examples and then have them share, and then we can transition it back to Jackie. So again, just in terms of thinking through all of the scenario, we worked through a lot. We didn't answer all of the questions. The intention wasn't to get through every single question tonight, but just hearing some of the discussion that you have. What are some of the strengths of the NAACP during these scenarios that you think can be helpful to people during the pandemic or doing some of the other subsequent flooding or hurricane-related damage that may affect your communities in Florida? I know some examples of some strengths that I've heard already is it sounds like the state conference has already supported branches being able to establish branch plans. And so having some of those processes in place, I think, is one example of a strength that I've noticed and just learned from hearing the scenario discussion. Another strength that I've heard from one of the branches and some of the examples of feedback was having a phone tree in place. And so making sure that the call lists are up to date and that people have a sense of how to get hold of people either via phone, via text, that are there. There's some other strengths that people want to list in the chat for their unit or for their branch.
See a few hands raised. Let me see if I can unmute some folks.
And then I see Mr. Scott talked about partnering with local law enforcement, city mayors, and along with the business chamber and churches. So he has the strength in partnership. And so maybe we can go to Mr. Scott first.
Let's see. Make sure I'm getting it right, Mr. Scott.
Oh, he's unable to mute. Okay, understood. Understood.
Are you able to talk, unmute right now?
Oh no, he's not able to unmute. Okay, sorry about that, Mr. Scott. So what we'll do is we'll go to Carol Lawrence, who talks a little bit about working collaborative as well for the Miami-Dade branch. Oh, we see Sababa Williams as well talking about partnerships. And so let's go to Ms. Lawrence to talk about the branches, and then we'll close out.
I have Carol Lawrence unmuted, so if you're able to speak a little to your strengths.
Yes. One of the opportunities that we've had in the Miami-Dade branch is to collaborate with local city leaders through invitations, participating with COVID-19 free testing, as well as provide other free services such as hand hygiene. We are launching a hand hygiene campaign within our branch, and the hope is to reach out to as many communities as possible, certainly channeling our efforts through the faith-based community as well. So we have had those opportunities to be able to participate with those partners. And, you know, it's not easy, but it's certainly worth the efforts. And I think continuing and being intentional about what we're doing will certainly will pay off for our community. And not just being intentional, but also being consistent in our efforts to fight COVID-19 and any other emergency that we may be managing as well. So that's one of the strengths that we have implemented with our branch.
Wonderful.
Thank you.
So that's a good way to close in terms of strengths. And so on the audio, I would love if you can continue to drop some of your strong points in the chat. That is very helpful. And I think will help kind of inform and influence a little bit of what we're working on. So Kanaya, last question for you. Are there other scenarios that Healthcare Ready helps build out? I know we did 2 big scenarios, right, that had a few different parts to it. But what other types of scenarios do you all help plan for?
So we have an all hazards approach to emergency planning. And so we know that disease outbreaks and hurricanes aren't the only thing people are thinking about. They may be top of mind for people in Florida, for example. So we know these scenarios are hopefully helpful to think through. But we have created a lot of different scenarios looking at tornadoes, looking at mass shooter events, actually, some shooter incidents. We've created so many scenarios that I can't bring to all to the top of mind right now, but we certainly look through a lot of different disasters, and we have a all hazards approach, meaning that we're not looking just at natural disasters, but environmental hazards and man-made disasters. Some of the events we talked through yesterday, we make up scenarios and think through how to have overlapping events to test emergency plans. So there is a full system, and I lead on our emergency exercise planning and love to create scenarios that break systems so we can learn how to best build stronger systems.
All righty. So it looks like Ms. Patterson is had to take a leave of absence for another webinar. So that concludes the scenario. Want to defer first to Chairwoman Eklund if she is on the line, if she would like to provide any closing remarks. All right, and then over to State Conference for Mr. Alston. I know President Nweze is not on the line. Is there any other closing remarks that you want to give for tonight?
No, again, I would just say that, you know, tonight has been awesome. Actually, I think the president, I do see the president still on.
Oh, good.
Yeah, actually, hold on. Let me not do that. Madam President?
Yes, yes.
See
yes.
if you can unmute her.
Okay.
If
And then
not,
I know
then
there's
I'll make some quick comments.
okay. And then, so after President Nweze, we have Ms. Eglin to make sure that we have the quiz all set up. And then we will make sure that folks get access to the quiz. And then keep going. So President Nweze, we'll pass it over to you.
Let's see if she's. I think she's still muted. I can just make some quick comments. On behalf of the state president and member of our national board of directors, similar as I mentioned last night, this has been her vision for this state. I think based on the conversation tonight, there are many different disasters that clearly we're preparing for, and we're excited that this training, discussion, and certification will help all of our units up and down the state. And again, thank you all to all the units that are on, and thank you for the good conversation and feedback. And 2 down, and we know 1 more to go. So again, we're excited. Thank you to the team again for tonight.
And then we have Chairman Eglin on the line as well. I think she's unmuted now. It looks like we're not doing, Ms. Eglin, did you want to close us out? Or did you have any other updates for the folks?
No, I just wanted to thank everyone again for attending. This is very, very important. As you hear, we have so many issues, and all of these issues are disproportionately impacting our communities, and we need to get as many volunteers trained as possible. I know that, we've had tremendous issues, and again, I want to echo Jackie's appreciation for your patience and perseverance throughout all of this. I am so tech challenged, but I'm learning. First time I've ever had anything to do with even trying to put a quiz together. So thank you for your indulgence while I, try to learn all of this. I certainly don't know how to administer it, and I wouldn't be able to do it without some type of tutorial. But I want to thank everyone so much, and I just hope that there aren't others like me who are so tech challenged that, they want to shy away from this testing, because when all of this is over, I'm going to be able to say, that I was able to live through it. And it was actually worth it. And it has been very good information. Thank you all.
Absolutely. And so I think there's some specific questions about a quiz tonight. So as Ms. Eglin mentioned, so I think what we're going to do is actually arrange for the quiz for tonight to be disseminated during a specific time tomorrow. And so be on the lookout for an email for that information. And then Jackie and team will continue to provide you all with information to make sure that you can meet back here tomorrow. I know that tomorrow and it's been a tremendous honor to be a part of just being able to observe and listen and learn. And so we're continuing to take these learnings and folding them into the training. And so be on the lookout for additional information. I think that the links that got you in tonight should be able to get you in tomorrow. And then we will go from there. So with that, thank you all very much and have a good evening.
Thank you.